Can holding your pee damage your bladder? You're sitting in a meeting, you're driving your car, or maybe you're lying comfortably in bed. You need to pee, but you decide to hold it. 30 minutes becomes an hour, maybe even 2 hours. And at some point, you start wondering, am I actually damaging my bladder by doing this? Here's the good news. For most healthy people, occasionally holding your urine is not going to permanently damage your bladder. Your bladder is designed to fill, stretch, and store urine. But regularly ignoring a very strong urge to urinate is a different story. And there are certain situations where holding urine can become much more problematic. I'm a practicing urologist, and in this video, I'll explain what actually happens when you hold your pee, whether your bladder can become overstretched, and when I would tell a patient, don't keep doing this. What actually happens when you hold your pee? Your kidneys continuously produce urine. That urine travels down the ureters and gradually fills your bladder. As the bladder fills, its wall stretches. At some point, nerves send signals to your brain telling you it's probably time to find a bathroom, but that first signal doesn't mean your bladder is about to explode. Your bladder is a storage organ. You're supposed to be able to delay urination for a reasonable amount of time. Your urinary sphincter and pelvic floor help keep urine inside until you're ready to go. So feeling the urge and waiting a little while is completely normal. This is something I sometimes explain to patients who have become very focused on their bladder. They feel the slightest sensation of filling and immediately search for a bathroom. But the first sensation of bladder filling doesn't mean you have to urinate immediately. In fact, for some patients with urinary urgency or overactive bladder, learning not to react immediately to every mild urge can actually be part of bladder training. So there's an important difference between waiting when your bladder is comfortably filling and repeatedly forcing yourself to hold a painfully full bladder for hours. Those are not the same thing. Can your bladder become overstretched? Yes, under certain circumstances. If the bladder becomes extremely full, the muscle in the bladder wall has to stretch significantly. A single episode in an otherwise healthy person usually doesn't mean you've permanently damaged your bladder. But severe or repeated overdistension can potentially impair how well the bladder muscle contracts. We see a much more important version of this in patients who develop urinary retention. Their bladder continues filling, but they can't empty it properly. Sometimes these patients have surprisingly little discomfort, despite having a very large amount of urine inside the bladder. And that's a completely different situation from simply holding your pee during a long meeting. This is something that surprises people. You might imagine that everyone with a dangerously full bladder must be in terrible pain. Not necessarily. Especially when urinary retention develops gradually, some patients become accustomed to carrying large amounts of urine. They may tell me, "But doctor, I can still urinate," and they can. The problem is that they may only empty part of their bladder. A significant amount can remain behind. That's why being able to pee does not automatically mean you're emptying your bladder properly. Can holding your pee cause a UTI? This is where you'll often hear very strong claims online. Never hold your pee because you'll get a UTI. The reality is more nuanced. Holding urine occasionally does not mean you're automatically going to develop an infection, but regularly emptying the bladder poorly and leaving significant residual urine can increase the risk of urinary infections in some people. That's especially relevant when there's already another reason the bladder isn't emptying properly. For example, bladder outlet obstruction or certain neurological bladder problems. So I wouldn't tell a healthy person, if you wait an extra hour, you're going to get a UTI. That's simply too dramatic. How long is too long? This is probably the question you're waiting for. How many hours can I safely hold my pee? Unfortunately, there isn't one magic number. It depends on how much you're drinking, how quickly your kidneys are producing urine, your bladder capacity, and your individual situation. If you've had 2 large coffees and a liter of water, your bladder may fill quickly. If you've barely had anything to drink, it may take much longer. So rather than setting a timer, pay attention to your body. You don't need to run to the bathroom at the first mild sensation. But repeatedly waiting until your bladder is painfully full isn't a habit I'd recommend. There's an interesting opposite problem. Some people become so worried about holding their urine that they start going just in case, before leaving the house, before driving, before every meeting, before going into a shop, even when they barely feel an urge. If you're constantly urinating at very small bladder volumes, you may become accustomed to going very frequently. For some patients with urgency, part of treatment is actually learning to gradually tolerate normal bladder filling again. So the goal isn't hold your urine as long as possible, and it isn't pee every chance you get. It's normal bladder behavior somewhere in between. Who should be more careful? There are some situations where I would be much more cautious about repeatedly delaying bladder emptying. For example, people who already have problems emptying their bladder. Men with significant prostate obstruction. Patients with certain neurological bladder disorders. And anyone who has previously experienced urinary retention. If you're frequently struggling to start urinating, have a very weak stream, constantly feel that your bladder isn't empty, or regularly need to strain to urinate, don't simply try to hold your urine for longer as some kind of bladder training. That deserves proper evaluation. When should you seek help? There is one situation where you should not simply wait. If you have a strong or painful urge to urinate but cannot pass urine at all, especially with increasing lower abdominal pain or swelling, you may have acute urinary retention. That requires urgent medical assessment. Also, get evaluated if you repeatedly feel unable to empty your bladder, develop recurrent urinary infections, notice blood in your urine, or experience a major new change in your urinary pattern. Conclusion. So can holding your pee damage your bladder? Occasionally waiting to urinate is usually completely normal. Your bladder is designed to store urine. But regularly forcing yourself to hold a painfully full bladder for long periods is not something I would recommend. And if the real problem is that your bladder can't empty properly, that's something completely different and should be evaluated. Remember, you don't need to urinate at the first tiny urge. You don't need to hold it until it hurts. And you don't need to pee just in case every 30 minutes either. Your bladder is designed to do something in between. And if you're wondering how often you should normally be urinating in the first place, watch my video on how often it's normal to pee next. I'll link it here on the screen. Thanks for watching, and I'll see you in the next video.